Hi, so today I'm going to be giving my current topic presentation on the Active Protective Tango Belt. So the Active Protective Tango Belt is a smart belt that has a 2.5-inch thick built-in airbag that quickly inflates when you fall. So it has built-in motion sensors that track your walking patterns to detect if you're at risk of falling. It also has Bluetooth and Wi-Fi so that it can send texts or emails to report when you fall to your healthcare provider, but only when the airbag inflates, so only when there is a perceived danger to the patient. And it uses a patented algorithm that is able to distinguish between a serious hip impact fall versus a collapse onto your bed, for example. It uses a rechargeable battery and is paired with an app that keeps track of adherence, daily wear, and things like that. So a little background on the making of the belt. Active Protective was founded in 2012 and has raised over $10 million for research and development of senior care technology. The co-founder and chief executive, Drew Lakatos, said, "Our vision as a company is to make hip fractures a preventable condition because it's the most devastating injury. We are protecting your hip because breaking the hip kills." So the inspiration for the belt came from stories that his wife, who was a trauma physician, would tell him about elderly patients who would come with broken hips, and it would usually lead to death. And then he also had a personal experience with his grandfather who broke his hip when he was actually in the process of coming up with the technology for the belt, and he ended up dying from a hip fracture. So why is this an important technology for older adults? Well, the population of older adults who are at risk for experiencing falls that result in injury in the US is currently increasing. And more than a quarter of older adults age 65 or older experience a fall, and 1 out of 10 of those adults reported a fall-related injury. So 95% of hip fractures are a result of falling. Among older adults, falls are the cause of 60% of injury-related emergency room visits and 50% of injury-related deaths. So costs for hip fractures have reached $31 billion annually now. So as you can see, a technology like this could really help healthcare providers take care of elderly patients. So how does this technology relate to this class? Well, older adults and elderly people are afraid of falling and aren't as confident in their ability to move, which could lead to a decrease in physical activity and exercise, which then leads to other health issues and increases morbidity rates. So a technology like the smart belt or the Tango belt can give elderly people more confidence in performing everyday tasks and reduce their fear of falling, which could encourage them to be more physically active and participate in more exercise. So why choose the Tango belt versus other protective hip wear? Although hip protector products such as padded undergarments, pants, or outerwear that you see here on this slide have been proven to be effective in preventing fall-related injury to the hip, it's hard to get older adults to adhere to wearing them. They can be hard to put on or add extra weight that elderly adults can't carry, and they can also be seen as embarrassing, so people don't want to wear them or don't want to be seen wearing them. The Tango belt weighs less than 2 pounds and is easy to take on and off and put back on. The buckle was tested on the weak claw grip of someone with severe arthritis. So all it takes is a 40-degree turn, and you can have it on, you can have it off. So it's easy for an elderly adult that's living on their own to use the Tango belt. So there was a case study that was testing the reliability and likelihood of adherence of the Tango belt. So they focused on the fact that patients and provider adherence to hip protective clothing is a barrier for implementation. but the technology used in the Tango belt accompanied by a mobile app, which can be used by the wearer's care team to view clinically relevant metrics that is taken from the belt's data, such as daily wear in hours, compliance, stability, and confidence, was proven to have a positive effect on adherence. The study was done at a large long-term care facility for elderly adults. The goal of the study was to implement the use of the belt into daily life of elderly patients and establish consistent use to decrease fall injury and improve mobility. Overall, they found that the average adherence rate for the Tango belt was 83% in terms of how many hours residents wore the belt compared to prescribed wear time. So this is a quick video of how it works. So as you can see in that video, as he is falling down to the floor, it quickly inflates and catches his fall so that he doesn't land on his hip. So just in conclusion, even though the Tango belt can protect against hip fractures, as a result of falling, it's important that elderly adults are still taking other precautions to prevent falls and are still being educated on how to correctly break and come out of falls, because the Tango belt sole purpose is to protect the hip only, so it still leaves you vulnerable to injury in other parts of your body, like your shoulder or your elbow. Yeah.